at a higher rate. The first would be that if you have an infection in the prostate, and that will cause that release to happen into the bloodstream of this PSA. The second would be that if you have a large prostate, so exceptionally large prostate, then it will cause an increase in this PSA being released. And the third is prostate cancer. And obviously, when we have a patient that comes to see us that has a high PSA, we have to consider, are we dealing with prostate cancer? Are we dealing with an infection? Or are we dealing with just an enlarged prostate? And we have to consider all the factors. We have to complete an examination. We have to look at what has happened. Did you have a problem before doing this blood test? Did you have burning when you pass urine? Did you have a fever? Any indication to say an infection? And we have to track what happens to this PSA and separate the cancer from the non-cancerous causes for this value to go up. So PSA is not an exact marker for cancer, and unfortunately, we don't have a perfect answer to a blood test or a urine test to guide us on cancer. So the only thing that we have at the moment is this PSA.
Thank you, Doc. We're just going to quickly go to the WhatsApp line again. It says, hi, what complications would you experience if your prostate is removed? What are the chances of having kids? How do you use PSA interpret? What is it? It makes it high or a false indication?
So the first question is, what would
complications
of having a prostate removed? Well, it depends on the way you have it removed. And the obvious thing would be to consider that the prostate is an essential part of your reproductive health, and with having it removed, we expect you to have either no sperm being released or very little sperm being released, and we touched on that earlier, that sperm will move back into the bladder, not cause any harm, but you would have, we call it dry ejaculations or retrograde ejaculations. So obviously for a guy that's younger, that's desiring fertility, it's not ideal. There are ways around that. So if you have a blockage and if you're looking at trying to preserve ejaculation still, then there's techniques that you can be done to preserve certain areas, but it's still not the gold standard,
Sure.
Right. And the second question, Shona, was on PSA.
Yes. How do you use PSA? I'm going to read it exactly the way it is there, so you'll be able to decipher. How do you use PSA interpret what it makes, does it make it high or a false indication?
I think what the listener is trying to touch on is, again, how accurate is PSA, and should we take it to heart that if you have a high PSA, you have prostate cancer?
Sure.
And as you just to reiterate.
Yes.
Yeah, so it could be related to prostate cancer, but it could also be very well related to an infection in the prostate, or it could be due to an enlargement of the prostate.